Hello, Brunswick County and beyond. Dr. James here with Coastal Integrative Health, and I've got my North Carolina's opened up, haircut, and clean shaved, uh, ready to go now. And so, what we're doing, we're going to be getting back on track with the questions that you guys ask here in the office and through email and Facebook here. And what we're going to talk about today is specifically traction, a lot of the different types of traction that are out there, and specifically today, talking about inversion tables. And so the question that I'll commonly get asked is, what do I think of these teeter, hang up, inversion table things? And it is a good question. Uh, First off, what is traction? What is it doing specifically? Well, let me grab a little model here, and let me grab the not terribly accurate spine. But what we're looking at with traction is basically on the back side of the spine, we have these little joints here called facet joints, and on the front side, these big kind of juicy discs all throughout the low back and really all throughout the spine, all the way up into the neck here. But what happens generally with traction is it kind of pulls it apart and separates it. This one a little bit more kind of bound up, so not probably needs some traction, but ends up tractioning, pulling it apart just gently, creating a negative pressure along that spine to open up those disc spaces. Anytime that we have any disc herniations, for example, that are kind of herniating out and pushing into a nerve, it kind of sucks that back in with that negative pressure, taking the pressure off that nerve. And the way that discs work is they are very innervated. Lots of nerves are on the outside of this ligament, this shell called the annulus. And think of it almost like an onion, has different layers to it. And inside is this gooey center. And basically that gooey center starts to kind of herniate out, pushing its way outward, pushing into nerves, but that negative pressure brings it back into center. And all the nerves, all the blood flow, it's on the outside, so it allows it to heal from the outside in. So typically with traction, you need multiple sessions to get the effect to last and have proper recovery. Now, specifically inversion tables, how do they work? Well, with inversion tables or the teeter hang-ups, basically, you're going to strap yourself in, typically at the ankles. There are a few exceptions to those, and you're going to be upside down, specifically 60 degrees from horizontal. Very rarely is it going to be completely 90 degrees perpendicular to the floor. The big question that we always have to ask ourselves, is it right for you? Typically, my patients, and you'll probably get the point of how right it is for you, is we want to make sure that patients don't have any heart disease, congestive heart failure, history of strokes, or at risk for a stroke. Are the patients generally weak? Are they able to get up themselves after they're doing the inversion table? Many times, a lot of patients would tell me, well, I can have my wife or friend or neighbor kind of watch me do it and then help me get back up. Well, if they get incapacitated, well, then you can't really get up, can you? So we want to make sure that you're physically fit to be able to perform getting not only back, but back up as well. And certainly, does it hurt whenever you are getting traction? Okay, it's probably not the right fit for you as well. Surgical replacements, certain surgeries, knee replacements, hip replacements, some can tolerate it, but oftentimes, especially if a patient has poor bone density, okay, we don't probably want to risk it in that sense as well. And certainly going along the lines of the heart disease, are you feeling lightheaded? Is there any tunnel vision? Are you seeing stars as it's going on? Again, that would be a sign that it's not right for you. And since inversion tables, teeter hang-ups, they can be pretty expensive for most patients. Typically, I'll recommend patients, rather than outright buying one, if they know someone that has it and they don't have any of those risk factors, to try it out for about 2 minutes, see how they feel with it. If any of those symptoms develop, if they can't get back up on their own, no go, don't do it. But if you can tolerate it for that 2 minutes, and generally what we need is traction in the spine, whether there's stenosis where the spinal canal is actually kind of shrinking down, or we have those pinched nerves from disc herniations, doing that traction will tend to help us out. But we keep it to short increments of 2 to 5 minutes. We build ourselves up over time. We don't do it for 10, 15, 30 minutes. If I hear that you're doing that, you're going to get a real nasty scolding from me. And just like any therapy out there, Specifically with traction, you want to kind of ramp it up. You'll do 2 minutes, maybe once a day, twice a day, maybe bring that up to 2 minutes, 3 times a day, and then up to 5 minutes, 2 times to 3 times a day. And then once we actually start to get that improvement and sustained improvement from sciatica or back pain or whatever is going on with the patient, once we start to see that improvement, then like any other therapy, chiropractic, physical therapy, acupuncture, massage, you name it, we start to back down on that dosing for it. And oftentimes I'll find if I have a patient that struggles with maintenance, for example, and they are a good candidate for it, say I can only get them out to 2-3 weeks before they start to really notice an uptick in their pain, and I can't really do a full maintenance discharge with them, then adding in that inversion table might help us get up to that 4, 5, or 6 weeks with them. So it could be a valuable tool for a lot of patients, but it has to be the right patient to fit it. If there are any of those risk factors, like I said, it's a no-go with them. How many of our patients are using traction out there? Certainly leave it in the comments below. And do you guys have any other questions that you've been thinking of that you want to have answered? I'm happy to answer them for you. So we're going to continue on with this traction theme here with our next few videos. And otherwise, you guys stay healthy, and I'll see you on the next one.